Assalamu alaikum and welcome. The question and the answer. First of all, the question and the answer to the question is actually in the complete video. The question: on standard ECG, we just see three waves. There is a fourth wave, but the question that I'm asking from you is actually the wave that is missing between these three waves. Number one, atrial depolarization. Number two, ventricular depolarization. Number three, ventricular repolarization. Now the point is, the P wave is representing the atrial depolarization. Then there is a segment and PQRS complex which is representing ventricular depolarization, and the T wave which is representing the ventricular repolarization. So we just missed the atrial repolarization. Now the question is why we don't see the atrial repolarization on the standard ECG. So for that, you have to watch the complete lecture. Here you go. T wave and QRS complex and T and U. First of all, leave U for a side, coming to the T. Yes, still T. The P wave stands for the atrial depolarization, or the P wave is formed when the atrial depolarize. And then what will happen? After the depolarization, the contraction of the atria will occur. The blood will come to the ventricles, then the ventricles will contract, so the depolarization of ventricle will occur. Now this is the P wave stands for the atrial depolarization, and the QRS stands for the ventricular depolarization. So now when will the atria relax? And what is this T wave standing for? The T wave stands for the ventricular repolarization. So now we've missed one thing, that is repolarization. Atrial depolarization is for being indicated here. That P wave stands for the atrial depolarization. So then we did not discuss in the graph the when atrial repolarization means relaxation. What will it do? Well, according to some texts, that the atrial repolarization is very feeble, very weak because of the ventricular contraction. When ventricles contract in a very fast way, so the ventricular wave is just hiding the P wave. The P wave, not the next wave, the atrial repolarization means atrial depolarization is done, but the repolarization is a bit like hidden by the QRS complex, or you can say by the ventricular depolarization. So in between this this area, or you can say between this segment, the atrial repolarization, repolarization is a bit missed, like hidden, you can say. So what will happen next is that the ventricles, first of all, the atria got contract, means depolarization happened. So this peak represents the atrial depolarization, and atrial repolarization is a bit hidden here, and the ventricular depolarization is this QRX complex is showing. QRX stands for the ventricular depolarization. So when the ventricles depolarize, they will contract. After the contraction, so the ventricles are also supposed to relax. Then what will happen? A kind of gap is seen here. So then what will happen? The next peak is observed in which the ventricles are relaxing. So now this peak, that is the T peak, which is representing ventricular repolarization. According to the depolarization repolarization strategy,